Okay, we're going to try this again. We tried to do a live a few minutes ago and the signal just shut down. So we rearranged the booster to see if we can have a unfettered signal. So hopefully if it starts buffering again and we lose the feed, we will try again. So hopefully you can stay with me or I can stay with you, as case may be. So again, I am Dr. Polly Heil-Mealey with Abundant Health and Wellness, and this is our regularly Friday afternoon lunch and learn. Today we're going to be talking about oral health, and so what we want to talk about is how the correct maintenance and care for your teeth can help the whole body. So we are located at Abundant Health and Wellness, which is a holistic healthcare clinic right in downtown Humble, Main Street, and Avenue C. So if you would like to come and see us, that would be great. We love giving you information and helping you learn new things. So today we're going to talk about oral health, and the first thing I want to do is talk to you about your teeth. So I am going to be showing you this tooth structure. Now, most of us think that the teeth are just bony outcroppings in the mouth. They're there to grind the food, tear the food, help you masticate the food so you can get the food into the stomach in a small enough piece so that the body can take care of it. And that is good. That is what the teeth are for. But what you may not know is that they are not just dead, bony outcroppings in your mouth. So that's why I want to have this little picture. I've got a lot of little pictures that I want to talk to you. So on the top of the tooth, this is what you see. This is the enamel. In this second layer here, this is the dentin. When you come down in this third layer, this is the pulp. And so when you get a dental cavity or a carie, as the dentists call it, you get a break in the enamel, it breaks into the dentin, and it can get into the pulp. Now you can see that the pulp is full of blood vessels and capillaries and that kind of thing. There's also a nerve that goes all the way down to the bottom of the tooth, and it actually connects down here in the bloodstream, and it will carry different things into the rest of the body. So this outcropping here, this is the jaw, right? And this is the gum line here. So this is the structure of the tooth. Now, a lot of times, like I said, I thought the tooth was just a dead thing that was just in my mouth to help me with eating, but not so much. Thanks everybody for joining. I appreciate you, and hopefully you guys are going to learn something from this, and we can help if you have dental issues. So when we're going to be talking about right now, we're going to be talking about root canals and that kind of thing, and we're going to be talking about how your tooth affects every area of your body. So if you are an avid Facebook watcher, you will have seen something like this, or you may even have seen this on your feed this week. Now, this is a very, very old chart, and what it shows is the teeth. This is the lower jaw, this is the upper jaw, and these are all the different meridians that the teeth are attached to. So each tooth is attached to a meridian, and really it helps to know what tooth is affected, because the nerve and all of the nutrients go through the bloodstream in that periodontal ligament. So I'm going to bring this picture back up just so we've got you can follow along. So the periodontal ligament is this little piece right here, and it is what holds the tooth in the mouth. So when a tooth is removed, right, they just jerk it out, which is why it's painful, because it's attached. There is a nerve at the end of it, and it is attached to the periodontal ligament. Now, the periodontal ligament is what holds the tooth in, and when the tooth is removed either by extraction, like your baby teeth fall out or whatever, on that case, that's a natural thing that the body does, so that's not a big deal. But when you have a tooth extracted or you have a tooth damaged, that periodontal ligament is damaged, and that periodontal ligament can have some issues. So what we want to do is find out what really happens when we have a root canal, because root canals are very, very popular these days, and we do not recommend them. And I see I've got some really sweet friends that have joined us, so thank you so much. So when you have a root canal, so what they do, you've had a tooth that's been so damaged that they can't cap it, they can't fill it, they can't do anything with it. So what they're going to do is they're going to excavate all of the dentin and all of the pulp. They're going to excavate way down in the root down here, and they're going to pack the whole structure with antibiotic material and some other material. I'm not a dentist, so I don't know what else other than the antibiotic. But they're going to pack it all the way down. They're going to put a cap on it, and then you're going to live to see another day. So what doesn't happen in these teeth, the roots are sometimes very, very tiny, and the dentist is not able to get all the way down to the bottom of the root. And so that part of the tooth, because it is cut off from all the capillaries and all that kind of stuff, because it's all been demolished, it gets gangrene and it gets necrotizing bacteria. It gets anaerobic bacteria. It's called by a lot of different things. So when that happens, the root, which is right here on the tooth, the root takes, or the nerve, takes that nasty bacteria and it goes through the nerve system, through the blood supply to whatever organ that the tooth is attached to, which brings us back to this. So I love this because it's very, very colorful. You can find it on the internet and it would be good for you to do. However, I'm just going to tell you the numbering of the teeth is incorrect. So when you go to the dentist and the dentist puts a probe in your mouth and the dentist is talking to the hygienist and they'll say, we've got a carie at number 23 on the dorsal surface. We've got a carie on number 18 at the whatever surface. So that's what she's doing, is she is numbering the teeth. So in this particular meme that's on Facebook right now, the teeth numbers are incorrect. Everything else is correct. Okay, so forget about the numbers. I'm going to show you the right numbers in a minute. But what I want you to understand is that if you have any kind of dental work, then you're going to have dental issues that are going to potentially affect your health long term. So what are some of the things that we have going on in the mouth? Well, we've got cavities, and so we will get fillings. Now, the filling is most of the time, if we have insurance, which hopefully we do, if we have insurance, the filling is going to be, most of the time, it's going to be a silver amalgam filling because they are the cheapest ones. Now, we think they are silver fillings because they look like silver, but actually they have mercury in them, and mercury is a neurotoxin. So the tooth, and I'm not going to show you all of my teeth, but I have tons of fillings in my mouth, and because I'm older, they're starting to break, and I'm having them replaced with porcelain or composite filling material because number one, it doesn't have the mercury, but number two, it doesn't conduct electricity. So the silver that's in the fillings is a conductor of electricity. And so in your mouth, if you've got bridges, if you've got silver amalgam fillings, if you've got crowns, if you've got gold teeth, silver teeth, if you've got braces, whatever, you are conducting different frequencies through the mouth based on what is in there. If you've got an implant, you've got a stainless steel screw or titanium screw, and so that's in the jaw, and that is galvanizing frequencies as well. So remember, we primarily are an energy medicine clinic. And so what we look at is to try and balance your frequencies. So if you have any kind of dental issue, it could mess up your frequency, lower your frequency, and if you've got that necrotizing bacteria in the gum line, then that is something that's going to have a problem with your energy frequency. So every symptom is a healing strategy, we like to say. So how many of us go to the dentist and we've got a plaque problem or we've got a tartar problem, right? So they will tell us that the plaque and all of that encourages tooth decay and whatnot. We don't necessarily agree with that. We think the plaque is a barrier. The plaque is it's a mucus-based substance in the body. The plaque is trying to make a barrier between the tooth and the gum line because there's some kind of gingivitis, there's some kind of other thing. So we don't necessarily want you to have plaque, so don't hear that. Plaque is a symptom that there's something else going on. So just kind of throwing that out there. If you have a bridge, you have a permanent bridge. If you have braces, your kids have braces, it conducts frequencies, and that frequency may or may not hurt you. So give you some case studies here. Okay, so we have a lady that came in and she had severe trigeminal nerve pain. Now, trigeminal nerve pain pretend like this is my skull and my fingers are nerves. You have 8, I know I only have 5, but you've got 8 cranial nerves that branch from the back of your head into your body, okay? You can Google it, you can look it up. Well, the one that comes right through here is called your trigeminal nerve. Now, this lady came in and she had severe trigeminal nerve pain, and what that meant was every time you touched her face, it hurt her. So if the wind touched her, if her husband kissed her, if her husband caressed her, she was brushing her hair, the hair fell across her face, everything was very, very painful. And so she came to see me and we worked on it and we were able to get it resolved. Well, 2 or 3 years later, she came back and she was having the same thing. So I did a dental evaluation on her, and it is the same energetic evaluation that we normally do, but we focus basically on the teeth. And what we found is that the nickel that was in the crown, she had crowns, and so what they do with crowns, if you have a crown, then you know they take putty, they make an impression, they cast the impression in a metal, normally it's nickel because nickel is cheap and strong, and then they will overlay that with a porcelain so that that fits on top of the tooth and you look pretty and you have full functioning of your mouth. But in her case, she was allergic to nickel. And so that nickel in her mouth caused her quite a bit of pain, and that trigeminal nerve pain was on fire. Now, we were able to, I'm going to show you this. It's not going to mean anything to you because it's just not going to. But this is a dental evaluation, and what we do is we evaluate the different teeth in the body. We find the tooth that is having the most stress, and then we look at the different dental materials, the different anesthetics, the different therapies, all those kind of things. We look at this and we challenge that, and we're able to send a report to your dentist. These are the anesthetics she needs, these are the antibiotics she needs, these are the metals that are compatible with her frequencies. And so we're able to correct that or prevent that from happening if you're going to do this before you have your dental work done. So in this particular case, she went to the dentist with our report, and she told the dentist that she wanted to have all of the nickel removed out of her mouth, and it was quite expensive, but guess what? The trigeminal nerve pain left. It just left. So why is that? Because the nickel was having its own frequency, which was disrupting the biointegrity of all of her other frequencies. So that caused her great pain. We have another lady who we worked with, and we're continuing to work with her, and she has various and sundry autoimmune disease issues, and I think she's got 3 to 4 root canals. Now, she's an older lady, and she's not in her 20s, and she's had these issues for over 10 years. And one of the things that sparked our investigation is she had to cancel an appointment because she had a problem with a root canal tooth. Well, anytime you have a root canal tooth, that is a harbinger of bad news. Now, I don't want you to panic, okay? If you've already had root canals, then there's a few things you can do to help with that, but we don't want you to panic, Okay, the people that need to panic are the people that have root canals and they don't do anything about it. Okay, so you're going to be able to do something about it. In this lady's case, we were able to energetically test the tooth. One of the teeth that was giving her trouble does need to be removed. But the other tooth will benefit from ozone therapy at the dentist. So don't think you can just take a report like this to your dentist. And this particular report is 4 pages, right? Don't think you can take this to your dentist and the dentist go, oh yeah, I believe this, and yeah, we'll do this, that, and the other, because they'll just think you're crazy. You have to go to a biologic dentist that understands bioenergetic frequencies in the mouth and how they can be very, very debilitating. So we are very hopeful with this lady that as she gets her root canals attended to, whether by extraction or by ozone therapy, that we're able to alleviate the cause of the dysfunction so that she can regain her quality of life. So that's what we're hopeful for. Now, also in the mouth, and I'm going to show you this picture again. Here is all this outside bit here and here and here. This is all the jawbone. So when you have a root canal or you have an abscess tooth, you've got a cavity, you don't have a lot of pain, it gets abscessed, all that nasty bacteria gets down here on the root and it travels through the jawbone. Now your bones, you may think your bone is just something that's dead that supports your skin and your muscles, but your bone is actually living, breathing, produces your red blood cells, produces your white blood cells. I mean, it is a wonderful, wonderful thing. And so when that necrotizing bacteria gets down there, it actually goes through the tubules of the jaw and eats away at the bone. That's why you'll see older people that have no teeth, right? They have had horrible dental health. The bacteria has gone into the bone. The bone has been eaten away. We call that cavitation. The bone has been eaten away and that bacteria is living in there. It is anaerobic bacteria. It does not need oxygen to live. And so it just lives in the jaw and it eats away because what? Bacteria is a creature. It lives, it breathes, it poops, it does all those kind of metabolic things. And so what it's doing in the jawline is it is excavating the jaw, and so the teeth have nothing left to hold on to. So in point of fact, the lady that I was referencing just a while ago, she has tremendous migraines. And nothing works. Drugs don't work. Essential oils don't work. None of my therapies have worked. CBD oil doesn't work. I mean, it works for everything. And this lady, it doesn't work. So when we're looking at the teeth, guess what? One of the teeth, if not two of the teeth, are in the migraine meridian. So when you're looking at this, and I'm looking upside down and backwards, so I apologize. Let me see if can I do this better? Maybe, let me move back so you can see. Let me see, can I do this better? Better maybe? Okay, so this tooth is migraine, this tooth is migraine, this tooth is migraine. We got some more migraine teeth, I gotta find it. Migraine. So all of the back teeth, right? There are the ones that are more symptomatic to migraines. And one of the teeth that she has a problem with is one of those back teeth. So this is really, really important because if you have issues, then you want to know that you've got to take some kind of remedial action. So there are different therapies for different people. So I can't say it's always going to be beneficial for you to have the root canals removed. I can't tell you it's always going to be beneficial for you to have ozone therapy. I can tell you that if you have that cavitation in your jaw, what they will do, and I have actually seen this done in a dentist's office, is they go below the gum line, they cut the gum, they peel it back, they go in with a drill and they drill out all that bacteria, and then they do like a bone graft with antibiotics and a bone graft to regrow that bone. Now, interestingly enough, the lady that we're talking about, she went to the dentist. She had a whole MRI for her head trying to find out what's going on with these migraines. Well, believe it or not, right here, there was a dark space in her jaw. And she asked the doctor, what is this dark space? And he said, I don't know, but it doesn't make any difference. And what we've learned in our training, because we get trained in dental issues, is that in the x-rays, and I have x-rays in my papers, I just didn't think to bring one out for you, but in the papers it shows the x-ray of the jaw where the cavitation is just a black spot. You don't see anything. So when you're looking at your x-rays, when you have x-rays at the dentist and they want to do it every year, I don't have mine every year because I don't like the x-ray exposure, but if you have a lot of root canals, if you have a lot of crowns, if you have had a lot of dental issues, it might be good for you to look at those x-rays, see along the jawline. So up on the top, it'll be up here above the teeth, be below the teeth on the lower jaw. See if there are any black spaces, because if you have black spaces, then you have cavitation, and if you have cavitation, you've got that anaerobic bacteria. Now, my dentist, when I learned about this, she said that I had some kind of a gum infection, and I said, okay, I'll take care of it. And she goes, you can't take care of it. And I said, well, as a matter of fact, I can. She said, it's anaerobic bacteria. We don't have anything that we can give you for that. And I said, well, that's okay, because I have things. And she just kind of laughed at me and whatnot. But when I went back for my follow-up evaluation, sure enough, the infection was gone and things were doing exactly as they needed to do. So I was really excited about that. So we have remedies. If you've got gum issues, if you've got gingivitis, if you've got plaque, if you've got all those kind of things, we've got help for you. Now this, just so you know, this is the chart that you will see if you come in to see me. So these are the correct numbers. We'll post this so you can actually look at this. And over here, the legend, what we do is we mark up the teeth, what tooth is a root canal, what tooth is a amalgam, what tooth has a crown, what tooth has been extracted, and so on and so on. And then we use this as the basis for the dental evaluation. So it's really, really important. If you are not able to get well, we might want to look at what's happening with your teeth. Now, we cannot do a body evaluation and a dental evaluation at the same time. They both take an hour, so that's just something that we need to do. Now, these are brand new products that we have in. Do not use if the seal is broken, it says here. And this is, it says organic gum health. This is 100% organic powder. We just got these in yesterday. I just used it first last night. And so this is made by my good friend, Dr. Julia T. Hunter. Now, Dr. Hunter is a medical doctor, and she has her own product line of organic homeopathic nutraceuticals. You may have seen some of her skincare products that we have here in the clinic. You may have seen her bioidentical hormones that we have here in the clinic. Well, now we've got this amazing stuff, and it is for the health of your gums, and it tastes good. And what you're supposed to do is you're supposed to stick a wet toothbrush, tap a wet toothbrush in the powder, rub it on your gums, leave it overnight. It's brown, so it's not pretty, but he's going to kiss you in the dark so he won't know. It tastes really good, so it's not going to be offensive at all. A little bit gritty, but you can get over that. It's got in it peppermint, clove, so that's what it tastes like. It tastes really sweet, and it's good. It's going to be good. So that's for gums. So if you have gingivitis, if you have plaque, if you have something like that, your gums are really red and swollen, your gums are receding, this is something we can try. I'm going to sneeze. You're going to have to excuse me. This is the new organic tooth powder. And so again, you dip your wet toothbrush in the powder and you brush your teeth as normal. Now, I am a real fan of tooth powder as opposed to toothpaste. I don't like toothpaste because the kind that you buy that has the sparkles in it. Well, those are plastic polymers, and they get stuck underneath the gum line and cause you all kinds of problems. So I don't like that. I don't like the colored ones. I don't like the ones that have the gel in it, because those are not organic products and they cause you problems. I don't like it because it has fluoride in it. Fluoride is a neurotoxin. And for all of those out there that say, but you need fluoride so you can prevent cavities. No. If you look at research, don't look at marketing, but if you look at scholarly research, communities that fluoridate their water have no better dental health and no fewer cavities than the ones that don't. So fluoride is a neurotoxin. It will dumb you down, rob you of IQ points, so we don't want that. So I'm a real fan of just taking plain old baking soda and, doing the pearly whites with that. I'm just a real fan of that. But this actually tastes better. It has in it sea salt. It's got thyme. It's got sage. It's got chamomile. It's got rosemary, and it's got peppermint. It's all 100% organic. Very good. I know her, and it tastes just like regular tooth powder. If you're into that, that's what it tastes like. Not so sure I like the containers, because I almost spilled it this morning, and that's a big container. So the whole top comes off. It's not like a pour, and so I'm not sure I like the container. So just be careful if you have kids and that kind of thing. You don't want it being dumped on the ground, because it's quite expensive, and you don't want to have a problem with that. But if your teeth are not healthy, your body will not be healthy. Carly says, do you recommend certain local dentists? Yes, I do. And we will put in the comments a website that has a list of dentists that are certified and qualified in your area, so that you can find a good biological dentist. Yes, would I suggest using these? Yes, we brought these into the clinic. We got them in yesterday. I tried them last night and this morning. They're not noxious by any stretch of the imagination. Gum disease runs in my family, and I do work on my gums. And this is one of the things that the dentist says: once you've got gum disease, it never goes away. Well, you know how they take that little pokey thing, and I like that technical term. They take that little pokey thing and they poke it, and they'll say it's a 1, it's a 2, it's a 3, it's a 4, it's a 5. Well, 4s and 5s are not good, right? 6s are horrible, and those are the gaps between the gum and the root of the tooth. Why does that happen? Something's going on underneath the gum line that's pushing the gum away, some kind of bacteria. So we've got another protocol here at the clinic that I actually have used, and within 3 weeks, it reversed the gum issues that I had. And so when I went back to the dentist, I had no more 4s and 5s. I never had a 6, but I did have a couple of 4s and I did have a few 5s. And so I was able to reverse that with another protocol. Don't have that, on the desk to show you just now. But yes, I am recommending them, especially if you have tooth issues or you just want to make a good choice. I know somebody's going to say, well, how long do they last? I have no clue. They are 1.2 ounces, so it doesn't sound like much, but you're using just a fraction of a gram every time you brush your teeth. So I'm not sure how many grams are in an ounce, but y'all can Google that and figure it out. It probably will last, I would think it would last a month or two. So at that pricing, it's not bad. The tooth powder is $15. The gum restoration is $32. So it's more expensive, but if it reverses gum disease, if it reverses all that kind of thing, then that is a good thing to have. So my time is up. Love you guys. Hope you have a great Friday. It's Father's Day. Take care of Papa and have a great weekend. Be good to yourself. Take care of your teeth, and I will see you next Friday.